Hello, I'm here to discuss a subject that I am very frequently asked, consulted to give an opinion on versus straight ahead traditional treatment of high lipids. Okay, that would be cholesterol, LDL, VLDL, which a lot of people don't even know about, which always needs to be tested, lipoprotein A, homocysteine, which isn't a lipid, but it always needs to be tested because there's genetics there, and then that makes the cholesterol stickier, the lipid stickier. So cholesterol, HDL, LDL, VLDL, lipoprotein A, homocysteine, and in a healthier way of treating that. So it's one of my favorite subjects to talk about. So you're in trouble now. So the bottom line is that number one is you are what you eat, food is your medicine, okay? But all lipid issues, look, a lot of people genetically have lipid issues, and their genetics, your genetics kick in as you go down the path of life. Sometimes it's stress that kicks them in earlier, which is whenever I do blood work, I always do homocysteine. I always look, even at 16, if I'm doing blood work on somebody, I look at their lipoprotein A because, again, the earlier you start to prevent, the better, okay? So you need to know, knowledge is power. You need to know what your genetics are. Find out, ask your parents, ask your grandparents. If that's possible, see what you can find out. If not, you can do blood work, and that's why we keep a lot of the blood work on the website, and that's why I talk about things like this. So, eating really matters because carbs and sugar, the way the body metabolizes them, they turn them either, and it depends on your genetics, it depends on how the enzymes in your body work. You may turn sugars and carbs to cholesterol, but somebody else may change them to triglycerides, okay? Triglycerides are worse. High triglycerides are worse than high cholesterol, but at the end of the day, don't eat your way into disease. You can fall off the wagon sometimes, but again, knowledge is power. Know what you're doing, and know what your genetics are. Know how your body changes things. If you're stressed, and who isn't stressed in today's world? If you're stressed, it runs up your blood sugar. I follow people's hemoglobin A1C as part of their whole lipid thing and their fasting blood sugar. Because I want to see if they are, how they're converting sugar. Because people who are stressed, their LDL will be higher. Some people genetically have lower HDL, and I'm looking at that because there's only certain things that you can do to do that. Time-release niacin. Triglycerides. So when you go to the doctor, they say, oh, your triglycerides are high, I'm giving you statins. Statins do not treat triglycerides. And what they found is that it'll lower the number, but not the risk. What do you care about? The risk. The risk means heart attack, stroke, deposition in your arteries. What raises your HDL and lowers your triglycerides is time-release niacin. That's why I keep it on the website. Time-release niacin is one of the best things that people can take. It also helps to clean your liver to a certain extent, okay? Because what happens when you have high lipids is that all those lipids deposit in your liver. So over time, a lot of time, but over time, it can give you liver failure. It gives you fatty liver. It's one of the big causes of liver failure in today's world. So, what I give people for high cholesterol and LDL is, first and foremost, I look at their triglycerides. And also, if your VLDL is high, that means your triglycerides have been high for a while, just like if your hemoglobin A1C is high, it means your sugar is chronically high. So high VLDL means your triglycerides are chronically high. You need to know that because that's not a good thing. It's deposited in your arteries, okay? So exercise helps lower them. One of the most important things that's generally forgotten, I see it every day with some of the biggest cardiologists, everybody goes to this and that, executive physical and whatever, and they spend $1 million to get all this blood work done, and nobody looks at their thyroid. And if you don't look at the thyroid correctly, you're not looking at the thyroid. Because if your thyroid is poorly functioning, and stress depresses thyroid function, high estrogen, people who are metabolic syndrome, women who struggle with their weight, women who have bigger breasts that are more voluptuous, and have higher estradiol when you test it on blood work, those women are metabolic syndrome. And what do they have? High cholesterol, high lipids as well. So you got to look at the whole picture. The body's an orchestra. If every instrument's not in tune, then you're not really doing the right thing by the person who's entrusting you to take care of them and to help prevent and reverse. And so what I do for people who have high LDL and cholesterol, yes, the first thing I do is look at their fasting blood sugar, what they eat, are they exercising, are they drinking water, are they eating green vegetables, what are they eating, all those things matter. But if I have to treat it because genetically they've got a problem, or no matter what, it's not coming down, or they're so stressed out from their job or life or their social situation or whatever, that their cholesterol and their LDL stays high, I give them red yeast rice. All red yeast rice is not created equal. Most red yeast rice in the market is not going to do the job. I use one that a cardiologist at Vanderbilt made, which I know from long experience lowers the cholesterol and the LDL. Now, some people will say to you, oh, it's not standardized. You follow the blood work, okay? You see the numbers. Show me, don't tell me is what it boils down to. If their triglycerides are high, if their VLDL is high, but if their triglycerides are high and high to the cardiologist, and I do go with the cardiologist on this one, you want your triglycerides to be 90 or below. And if you have a strong family history of heart disease, sudden death, whatever, you want them to be 70 or 80, okay? But you start off with time-release nights, and you have to start off slowly with that. You cannot take it on an empty stomach, otherwise you'll get itchy, red, niacin rash for 30 minutes. So you start out, I give it to people one time a day with food, biggest meal of the day, and then every 2 weeks, I'll go up. I may go up to 1 pill twice a day. It depends on what the triglycerides are. You've got to have somebody who's following your blood work, okay? But insight into how to do it correctly, because I see it not done correctly all the time. You need to have your thyroid checked, and not just the TSH, which is a very inaccurate blood test. You have to check your free T3, your free T4. You have to check your reverse T3. You have to look at your thyroid peroxidase and thyroglobulin antibodies. All this blood work is on the website. And so you have to look at the whole thing. And you have to know what your iodine is. Because if your iodine is low, then your thyroid uses iodine to produce thyroid. And so I'm also looking at people's serum iodine levels, okay? And also iodine is what your immune system uses to kill. So again, in the vein of giving people things that are doing a lot of things with one pill, that's what you do. So I'm checking all those pieces of the puzzle. So time-release niacin, red yeast rice. Now, the pharmaceutical statins come originally from red yeast rice, which is nature's statin. There are a lot of people, the statins are well known to chelate, to lower, to rid, to abnormally decrease in a pathological way your coenzyme Q10. So you have to take coenzyme Q10. Again, you've got to take the right dose because you've got to replace your coenzyme Q10. How do you know if it's low? Well, some people get shoulder pain. Some people get cramps in their legs or feet. So if you're taking red yeast rice, you need to be taking coenzyme Q10. And it used to be it was 100 milligrams a day, but again, all coenzyme Q10 is not created equal. So you need to take coenzyme Q10 200 milligrams a day. And if you're having to take a big dose of red yeast rice, meaning, look, I start people on red yeast rice 1 pill a day, depending on what their levels are. I may go up to 1 pill twice a day. And in some people, I have to go up to 2 pills twice a day because they have such a genetic challenge with everything and all stress, raising their blood sugar and increasing cholesterol. And so coenzyme Q10 you need to take. If your thyroid is not therapeutic, healthy, okay, and what is that defined by me? I want your TSH to be 0.5 or lower, okay? Not too low, but again, this is why you need to have a doctor that's helping you, but why I'm also giving you some information. Now, if your adrenals are low, your adrenal glands sit on top of your kidneys. If they're low and you're all stressed out, that affects your TSH. So sometimes I see people who their TSH is high, meaning it looks like their thyroid is low, but you do their free T3, free T4, and it's normal. Then and always with thyroid, you need to look on the website at the symptoms of low adrenals and low thyroid. Do you have those symptoms? Look at your tongue. Is it scalloped on the edges? Is it fluted? That's an old original symptom for 100 years of low thyroid. Are your feet cold? Are your toes cold? Is your hair falling out? Are you exhausted in the morning? Are you exhausted in the afternoon? But thyroid is an imperative part of lipids. And I see every day people have been to some of the best who nobody's addressing their thyroid, and you're never going to win with your lipids. And also, time-release niacin is not utilized because the doctors have to tell you that you have to take it with food. You have to start slowly. And so the other thing is this. Now, some of these things can increase some of your liver enzymes. Your liver's having to metabolize, break down all these things, just like it's having to break down food. And if you're drinking or doing anything else that maybe you shouldn't be doing, then it's harder on the liver. So the other thing, which is always good to take, is antioxidants. Green, the more green, the better. Milk thistle is a great one. But what's even better than that? My favorite, glutathione. Glutathione helps clean your liver. It's one of the best things. It's much stronger than milk thistle. It's one of the best things you can do. So, red yeast rice, time-release niacin, thyroid, iodine, homocysteine. If your homocysteine's high, it makes your cholesterol stickier, which means it's more likely to deposit in your arteries. What do you take for that? Again, why is this on the website? Optimized methylation, which is what you take if it's low. If it's lower, I give people methyl B complex, which is all the B vitamins methylated, because if it's not methylated, it's not going to work well. B vitamins, great for your skin. So when I see people come in and they're just on methyl B12, that's not the right tool for the job. It's optimized methylation if your homocysteine's high. What is high? Look, I try to keep it 9, and even in Europe, etc., that number is the correct number. And you want to keep it at 9 because that's a gene that turns on. And when you're really stressed, that gene can turn on. So you got to follow it, and you should have your blood work done every year. Lipids, you got to take care of them. It causes big problems if you don't. So imperative to commit this to memory. Thank you.